Why do people look so weird out there?
Why are they so puffy and bizarre?
If you're aging and your skin is hanging, what do you do? And how do you avoid overstuffed syndrome?
What is overstuffed syndrome?
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Do you ever look at a random stranger and wonder why they look so puffy and weird? Chances are they have too much filler in their face. In today's episode, we're exploring dermal fillers, what they're good for, and why they're being used way too much and inappropriately, resulting in what I call overstuffed syndrome. We'll also take a look at the dangers of filler because not only could you end up looking weird, but you could risk being scarred or disfigured. Today, I'm joined by Dr. Judy Rubin to discuss why this is happening and how to avoid it. Hey, we're back, and I'm here with Dr. Judy Rubin, and we're going to talk today about overstuffed syndrome. Why do so many people have too much filler?
What is overstuffed syndrome? I've never heard of this before. This has to be a Kate-ism.
Okay, it might be a Kate-ism. It's really what I call when someone just got way too much filler, and I think I understand why. And so I wanted to talk about that today. So when someone comes to me, and let's say they're my age, 56, and they've got a little loose hangy skin, they lost some volume in their face, there are a lot of options to treat that. And in general, I usually use multiple modalities to treat that. So what happens is, as you get older, there are a bunch of things that happen, but the biggest things are the skin starts to thin out. Usually by the time you're 30, the cells inside your skin that make collagen and elastin go dormant, and they don't make more. And your body breaks those things down at 1% to 2% per year. So over time, you're losing those things and it's not being replaced. So your skin starts to thin out, and it just gets thinner and thinner as you get older, and eventually starts to retain the wrinkles and starts to sag. So we spend a ton of time in our office focusing on waking those fibroblasts back up for you and making collagen, either enough to prevent the further loss or doing kind of bigger guns things that actually thicken and tighten your skin and build up a ton of collagen and elastin. So we do a lot of that. And then the other big thing that happens is that you lose volume underneath your skin. So the face underneath your skin, the infrastructure holding your skin up, all that stuff is changing your whole life. So your bones are remodeling your whole life. So it's important to get your calcium and vitamin D. But also the muscles are thinning out and weakening. And then the fat pads start to dissolve away and separate out from the muscle. And everything starts to diminish so that you start to get scooped out in areas that you didn't used to be. So when there is volume loss, when you fill that back up, it looks great. It looks like it used to look. But if you take somebody with some loose hangy skin and you plump that all up with filler so the skin is taut, now you've got volume in areas that you didn't used to have volume. Now you've got extra volume, and it's super bizarre looking because you've got extra skin that you're trying to prop up with more volume. And so I think that is the biggest thing that leads people to overstuffed syndrome, is because they've got one tool to fix a multifactorial problem.
Yeah, that's why you want to have lots of tools and address the different problems that the patient has. And as you age, as you said, you lose that collagen, you lose that elastin. And if you fill someone with filler, you're going to increase their volume, but you're going to do absolutely nothing for the health of their skin, the thickness of their skin, the tightness of their skin, and the number of cells called fibroblasts that produce collagen, elastin, and the proteins, the most famous of which is hyaluronic acid, that sits in the dermis and pulls water.
Exactly. So I think one of the big reasons this is happening is that a lot of places just don't have those tools. So that's one big thing. Okay. So most med spas and any aesthetic clinic, even dermatologists and plastic surgeons, they start out with injectables, Botox and filler. Those are the main things they start with. And a lot of places haven't bought anything more than that. So that's their one tool that they want to fix everything with. So if you only have one tool, then that's all you do. And so you cannot fix a skin problem with filler. It's just not possible, right? So obviously you want to go to somewhere that they can do all the different treatments that address all the issues, not just one. But the other big thing is that the injectors who you go see in those spas, even if the spa has other tools, they only do one thing often, okay? And so they will make money if they inject something in you. Yeah. But if they recommend something different, they won't necessarily make money. And not only that, but a lot of places have incentives set up so that if they inject twice as much on your visit, then they make way more money. Yes. And so if you really only need 1 or 2 syringes and you walk out of the spa with 4, you just have way too much volume, or you probably didn't need that much. But that person had incentive to sell you that. And if they're willing to pay for it, they will sell it to you. Yeah. So I had a patient a number of years ago. I mean, she's still my patient, but she is young and she doesn't like these little dimples in her cheeks. And every 8 to 12 months, we would fill the dimples in her cheeks, and that's really all she needed. And then when COVID hit and we were on a lighter schedule, she couldn't get in with me, and she went to another place, and they put 4 syringes of filler in her cheeks. She was, I think, in her early 30s at the time. Wow. This was a Friday. She emailed me the next morning a bunch of pictures, and she's like, Dr. D, I made the hugest mistake ever. I will never do this again. Normally I would put half a syringe. They put 4 syringes in her cheeks, and she sent me these pictures. She looked like a chipmunk. She looked ridiculous, and she really regretted it. And I just think that a lot of places work like that, where if you're willing to pay for it, or if you say you want something, they'll sell you the most that you'll buy. So I think that's a huge contributor to why people are just overstuffed.
Yeah. And I know that you don't do this in your practice, and we don't do it in my practice either. We inject the patients so that they get the desired cosmetic result, but they don't look like they're not human.
Yeah, looking normal is one of those key things about filler, okay? So I think the important thing to remember is that when you have a focal divot in your cheek and there's a volume loss there and you fill that back up, it looks fantastic. So filler here is not the evil, being in this. It's not the villain here, okay? But if you have loose, hangy skin and all you needed was a little bit of filler and then some treatments to your skin to tighten it, the solution is not more filler.
Agree.
So let's talk about skin tightening because I think that goes hand in hand with other, solutions to aging. What do you do for skin tightening in your practice?
So we use radiofrequency microneedling, a particular machine called Potenza that has infusion. And I really like the infusion component because we can infuse things like Sculptra or PRP, maybe exosomes.
That's really cool. I have a different device called Genius, and it's very, very similar, but it does not have that infusion capacity. We do a fair amount of Sculptra and those other things as part of it, but they're not actually getting infused during the treatment. I think that it's really good to know as a consumer, like RF microneedling is the most precise way to target the dermis, so the dermis thickens and tightens, okay? We can control the depth of where that energy goes really precisely, and it's really effective. You get a massive increase in collagen and elastin, and it's one of the only modalities that's been shown to make elastin in addition to collagen, and that's really important for the texture and the springiness of your skin.
Important tool to have in your toolbox.
Super important, yeah. So there are some other devices I'd love to cover that we don't use so much, but I think it's important to know about them. So there's other RF heating devices that don't use needles, but just use heat. I think probably the oldest one is Thermage. You might be familiar with that. We had a device years ago called Exilis that did something similar.
I had Titan in the late 1990s.
Right. And back then that was we didn't have RF microneedling back then. And basically the heat is absorbed into the dermis and it turns on those fibroblasts and stimulates them to make some collagen. It's not a super robust effect, but it does a little. But the results from that were sort of
They were okay.
Yeah.
It was the best we had.
It's the best we had back then. Now we have much better tools. There's another device that is still pretty popular out there, and that's called Ultherapy. And this is my own personal pet peeve. I really can't stand Ultherapy. So Ultherapy is a device that uses ultrasound to target the dermis to stimulate collagen there. And as a retired, or I like to say recovering radiologist, I do know a lot about ultrasound. And one of the problems with ultrasound is that it penetrates. It doesn't stop at the dermis. It just keeps going. And so if you're using very strong ultrasound, it's going to hit the bones and that's going to hurt like heck.
It is.
And it's also going to hit the other structures under the skin. So for instance, you can't treat the skin right over the thyroid because it will kill the thyroid. Okay?
Not a good idea.
You run the risk. I mean, the salivary glands are a little bit deeper, but you do run the risk of injuring the salivary glands. I mean, it's just not a great tool because it's so incredibly painful and also pretty dangerous.
Yeah.
And although it does work to tighten skin, I personally don't think that it works as well as RF microneedling. So the downsides of Ultherapy just absolutely do not outweigh outweigh the upside. So I don't think it's a great device. When it came along, it was really before RF microneedling was around. And so I get why people adopted it, but I think those should all be kind of dumped.
I agree. And then there's a CO2 laser, which is a fully ablative laser. It's about 20% ablative, I should say. We used to have a much bigger area of ablation where they would put holes in the skin. And it's a great tool, but again, I agree, not as good as radiofrequency microneedling. And with CO2, you have downtime that's significant, but you don't have that with radiofrequency microneedling. And then there's the whole bunch of, pixels and fraxels, erbium lasers that are ablative as well, but still, I don't think work as well as the radiofrequency microneedling.
Yeah, for skin tightening, I would say no. For skin resurfacing, I think those are great options. There's ablative and non-ablative options for skin resurfacing. The non-ablative ones, you have to do several treatments. However, there's very little downtime with those. But with the CO2, if you're the right candidate for that, you could do one. You just have to know that there are some bigger risks. So there's one more thing I'd love to talk about, since you're, as far as I know, the only expert I know about deep peels, especially the blue peel. So the only thing I know about the blue peel is about 10 years ago, I was at a lecture where they showed a very famous actress. One picture was her at 35 and the other picture was her at 62. And she looked almost exactly the same. Her skin looked amazing. And the lecturer said that, this was long before any of these other devices, and that she had the blue peel every couple years. And so I'd love for you to talk a little bit about why the blue peel works and what you use it for.
Yeah, I do less blue peels now that I have radiofrequency microneedling, but it still has its place. The thing about a blue peel is it has 20% to 28%, depending on how you mix it, trichloroacetic acid. So you really need to know what you're doing if you're using a blue peel.
Because that's a really, really strong acid peel.
Yes, and you can go too deep. If you go too deep, you can kill the vasculature. So really, the blue peel should only be in the hands of a physician, someone who has done these for years, understands what they're doing. I do quite a few blue peels, but I understand the different levels and where to stop. And there's certain signs that you look for. But it's a very effective peel, and it's especially good for melasma, but only someone who really understands it and should ever attempt it.
Yeah, and I would say that I'm a big fan of keeping things super safe. So unless you're a expert, I would not be attempting blue peels. But the key thing is getting down into your dermis and doing enough damage in the dermis itself to stimulate collagen and elastin without too much downtime and without too much risk. And that's why we both really like RF microneedling for that. So over time, it doesn't take just one treatment. There's a series of treatments, but over time, your skin will get thicker and tighter. It's pretty awesome. So you're basically aging backwards slowly.
Yeah, with veritably no downtime.
Yeah. So that's pretty cool. So let's go back to talking about filler and when we do use it, because we both use filler in our practice and it serves a really important role. So there are actually several different kinds of fillers. In my practice, we really only use hyaluronic acid fillers because those are dissolvable, meaning if you need to undo what you just did, you actually can with an enzyme called hyaluronidase that we keep in the fridge. Luckily, we don't need to use that very often. But if you need to reverse something, you can.
And we do exactly the same thing.
Yeah. So there are a couple of other fillers that are non-reversible. I do not recommend using those. Those are more dangerous. If you do have a complication, you cannot do anything about it. Or if you simply just don't like the results, you can't undo it.
You're stuck with it.
Yeah. So stick to hyaluronic acid fillers. That includes all the Juvederm family, the Restylane family. There's some others like RHA and a few others. But in my practice, we primarily use Restylane and Juvederm. How about you?
I use Versa a lot, which is from Prolineus. I also use Juvederm family, and I'm using some of the Restylane family as well.
Mm-hmm. I especially like Restylane makes a few flexible fillers that I like for the lower face.
That's the ones we
you
use.
Have to move your face. It's nice to have some flexibility. Yeah. So when we use fillers, we generally do this for the purpose of either filling volume loss, so you see visible volume loss that you can replace. So it's helpful for that. And then sometimes filling little fine lines in the skin. You can use teeny tiny little bits in the skin itself to fill little lines and make them smoother.
Yep. And the result is immediate.
Yes. That's one really huge benefit of fillers. It really is. You see the results right away. Now, it doesn't mean there isn't a little swelling. So fillers are what they call hydrophilic, meaning water wants to flow into them. So you can put it in the body and pretty much all of them swell at least a little bit, if not a lot. Some of them swell a lot. But that, the peak swelling is generally the next day, and then that kind of peters off over the next couple of days. So there will be a couple of days where you feel a little like it's a little much, but then that goes back down to normal.
And you can usually feel it for a couple of weeks, and then it will go into your skin, becomes part of your skin.
Right. It does blend in nicely with your skin generally, or it should. So the limitations, so it has an immediate effect, but then once you put it in, your body starts breaking it down, and over time, it just dissolves away. For the most part, filler's gone in a year. It kind of depends on how vascular the area is where you're putting it. So if there's a lot of blood flow, like in the lips, doesn't last as long. If it's kind of deep, like in the cheeks, it lasts longer. So that's a nice discussion about filler. Let's talk a little bit about Sculptra, because a lot of people think of Sculptra like it's a filler, but it's not.
It's a biostimulant.
Yes. So what does that mean?
So it stimulates your dermis. It stimulates your fibroblasts in your dermis to make collagen and elastin, and it stimulates the production of proteins like hyaluronic acid in the dermis. So it is a powder called PLLA, poly-L-lactic acid, that we mix with sterile water, and then we add lidocaine to it and let it settle. Pull it out of the bottle, and we inject it just in the deep dermis in a crosshatch pattern to stimulate your skin to make more elastin, collagen, and hyaluronic acid.
Exactly. And I love Sculptra. It helps to lift a little bit, and it fills volume in a very, very natural way. It looks very normal. It just doesn't look weird at all, I guess, because your body is making its own collagen. You're not putting, other stuff in that has its own shape. So in my practice, actually, we will often do Sculptra on the same people we're doing RF microneedling. We don't do it at the same time, but those two things are complementary to add volume and lift and increase collagen and elastin and thicken and tighten the skin. So it's really a nice combination. I do select out patients who look like they need volume. If somebody is kind of pretty thin, lost a lot of volume in their face, it's a great option. For people who already have plenty of volume in their face, I don't tend to use it. We also have this device in our practice called M-Face. Do you have that one?
I do not.
So M-Face has been around for about a year now, and it's a really interesting device. We don't use it nearly as much as the RF microneedling. M-Face does two things at once. So it uses RF heating through applicator pads. So it's not operator dependent the way the old devices used to be. It just comes through the applicator pads. And that has been shown to make collagen and elastin, which is nice. It's not nearly as much as the RF microneedling, but it does work really well for that. And then the other thing it does is it actually stimulates the lifting muscles of the face. So it looks really bizarre and you have this really crazy repetitive stimulation and your cheeks bulge out. But what's really interesting is that it increases the strength and tension in those lifting muscles and actually increases the volume of your cheeks by 1.4 cc's. So that's like having almost a syringe and a half of filler in your cheeks without any filler.
Because you lose your muscle tone as you get older.
Yeah.
So it's building the muscles. It's like doing curls on your facial muscles.
Exactly. Yeah. Someone asked me about facial yoga, and I'm like, well, it's got to be way stronger than that because it is a pretty intense, repetitive stimulation of these muscles.
So then you're addressing the laxity of the skin, losing collagen and elastin, losing the facial muscles and increasing the volume in the fat pads, all the things that happen as you get older.
Exactly. So it would, and plus no needles and no downtime. Okay. So the drawbacks of M-Face, it doesn't touch right around your lips, which is where we all want more collagen and elastin. I mean, we all want that desperately. That's where we get these more wrinkles. And the applicators don't go there. And then also it only gets so close to your eyes. Mm-hmm. And with RF microneedling, we can get very, very close to the eyes. And with M-Face, we just can't get quite that close to it. And so it doesn't quite stimulate collagen in all the places we really want it to.
Well, that's why you have radio frequency.
And that is why we have RF microneedling. So M-Face is a nice, it's a nice treatment, and there's no needles, no pain, no need for anesthetic. You can do it on your lunch hour. So it's an option for people who really don't want any of those bigger things, but it isn't 100% of what we really are trying to do with prevention by giving you the collagen and elastin in all your skin.
But it builds your muscle.
But it does build your muscle, which nothing else does.
Another tool in the toolbox.
Exactly. So all that said, we've talked about a lot of different tools here. Why do you think that people, like, what makes people look ridiculous with filler? Like, what is the thing that makes them look weird?
I mean, when I inject someone, and I'm sure when you inject them as well, we're trying to make them look younger but human. So the important thing is that you want people to not know that you did filler. You just look good. You look younger. You don't look abnormal. Your lips aren't larger than they should be. Your upper lip isn't larger than your lower lip. Your cheeks aren't sticking out like an alien. You just look like you're younger.
And that's when filler's done right. I think that, the problem is when filler is not done right, it just looks ridiculous. Like, let's talk about the phenomenon of people doing too much in their upper lip. We've seen I don't know, if you look on Instagram, there's so many before and after pictures where the person's upper lip is bigger than their lower lip.
Yeah, and the lower lip should be 1.5 times to 1.8 times the size of the upper lip. Should be larger. So the lower lip should be 1.5 to 1.8 times the size of the upper lip. And I think that it's becoming more normalized for the people to ask for upper lips that are larger or the same size as their lower lip. So people will come in and they'll ask to have their upper lip be the same size as their lower lip. And, as a physician, I can't do that. I won't do that. It looks like a baboon. And I think that many times the people who are injecting because they make money and they don't care as much about the patient's physiology. I am honor bound to just first do no harm.
Yeah, I think when people ask me for things that are just unreasonable for me, I just won't do them.
Me too.
So they can't, this is the practice of medicine and it's my practice. So when people ask me to do things that I don't find either medically or aesthetically sound, I just won't do it. They'll have to find someone else to do that if they really want that badly. But usually I can talk them out of it.
Yeah, and it's important to know the harm that you can do. So I've had a patient who wanted me to add more filler to her lower lip, and her lip was peeling. So there was no hydration on her lips because her lip was so big that the dry portion of her lip was just peeling. And you have to know when to say no and not care so much about the income and care more about the patient.
Yeah, absolutely. I think this would be a good time just to go over briefly the main dangers of filler, which we have not talked about yet, because filler is actually the most dangerous thing we do in the med spa space.
I agree.
So the big thing we worry about is that, so filler is a gel, and if it gets into a blood vessel, it could block the blood flow in that blood vessel. Okay, that's called an occlusion, a vascular occlusion, and that is a medical emergency. So we have a pile of hyaluronidase, the enzyme to break it up if we needed to. At my office, we've never had an occlusion.
Yeah, when we always have 12 bottles of hyaluronidase and we hardly ever use it. We might use it if someone comes in from another office and wants something dissolved. But you always have to have hyaluronidase and be ready to use it if you have a vascular occlusion.
Absolutely. And I would say, from my understanding, many offices don't have enough. It's been, people have reported needing actually even more than 12 vials to dissolve an occlusion. I think that it's a very scary thing, but you need to have that much. They're very expensive, so you got it. And they do expire, so they sit in your fridge and you don't use them, but you have to have them. So you want to make sure that wherever you're going is on the up and up, and it has the ability to take care of an emergency if you had one. I actually have a little handheld ultrasound machine that I have in case this ever were to happen. I've actually used it once. I had a patient who came into my place for a facial the day after she had filler at a dermatology office here in Seattle. And she asked my esthetician if the, dusky mottled look was normal. And my esthetician came and got me. And I thought, oh my gosh, that looks like an occlusion. And I whipped out my ultrasound and indeed, I could see a lot of hyperemia. I could see a lack of vascular flow in the central area of where this duskiness was. But I could not see the vessel. When a vessel is occluded, it's actually much harder to see with ultrasound. And I told her that it was an emergency. And I said, I can easily, well, not easily, it would be very hard to dissolve. But I said I would treat it for her. But I told her, I handed her her own cell phone. I said, call your dermatologist right now. I told her what to say. And I told her that they should treat this right now, this second. And they responded appropriately, and they said, come on up, and they treated her, and she was okay.
So she had lack of oxygen, lack of blood flow to an area of her skin, but she did not lose her eyesight.
Right, yeah. Doesn't necessarily mean you have to lose your eyesight, but you can necrose off parts of your skin. So, most occlusions are resolved without any permanent scarring, but many end up with permanent scarring. There was a recent case. There's this woman here in Seattle who went to, actually it was an ENT surgeon, and had filler in her nasolabial fold and had a very, very, very bad dramatic occlusion. She has very bad scarring and lost part of her nose and had to have a nasal reconstruction. And there was a lawsuit that was settled. She couldn't name him, but she's all over TikTok talking about her experience because I think she wants to educate people so that people don't have this happen to them. I think the most important thing is knowing if you're going to have filler, this is a possibility, and make sure you're going to somebody who's legitimate, who knows what they're doing, who can treat it if it happens.
And it wouldn't be unreasonable for you to ask as the patient whether or not they have hyaluronidase at the office in the rare instance that there might be an occlusion.
Yeah. And not just one vial of it either, because you can go through many, many vials of hyaluronidase trying to dissolve an occlusion. There are some other things that are not nearly as awful as occlusion. So number 1, 2, and 3 awful things are occlusion, occlusion, occlusion. There are some other things that can happen. The filler can migrate. It doesn't happen a ton, but it can migrate around. So once you put it and you like it there, it can actually move a little bit, and then you just don't like it. It doesn't usually migrate into an area that causes a problem. It just doesn't look as good.
But I've had patients come into the office and tell me that the last place that they got filler, they told the patient, or the person who did the injections told the patient that they should move it. And I tell the patient, never move it.
Well, yeah. I mean, I have not seen a lot of migration, but I think the most common place that I have seen it has been around the lips.
I've seen it under the eyes.
Oh, yeah. Terrible. So, and then, the other thing that can happen is if it's placed too close to the surface of the skin, you can actually see it through the skin. And that looks a little bluish, and that's called the Tyndall effect. That's also not very attractive. Yeah. And then if it's done unevenly or in a lumpy way, or too much here, or a little too little there, it just looks funny. So there are a lot of things that can go wrong with filler. I think that's why we really, really use it conservatively and very, very carefully. And although it does have its role, it's just one of many, many tools.
But it's also an art form.
Yes,
so
very much.
You need to know how much to use, and that might be, I always start with a very small amount, and then I'll have the patient come back 2 weeks later and evaluate them again. But, it's an art to know how much to put, where to place it, how to place it, and how to reverse it if you need to. And many times patients go in and they get way too many syringes, and that's not the art of filling.
Exactly. So in summary, many med spas incentivize their injectors to inject more, whether you need it or not. They'll try to upsell you or convince you that you need it. If you get that vibe, just leave. Make sure you know who you're seeing. If you have never seen a doctor or NP or a PA in some states, and you only see an RN, or even someone who has no license, that's not legal, just leave. If the provider only talks about toxin and fillers with no mention of anything else, they either don't have the right services or possibly even don't know about them. Go to someone you trust who can explain all about the skin and what's underneath, and can explain exactly when and why we do different treatments like laser, Sculptra, toxin, and filler. Don't let overstuffed syndrome happen to you. If you have a question or a crazy story of your own that you'd like to hear on Med Spa Mayhem, contact us through our website, medspamayhem.com, or check out our contact information in the liner notes. If you learned something today and like what we're doing, please give us a 5-star rating and read the book. Med Spa Mayhem is coming out June 11th, 2024. The link to pre-order is available on medspamayhem.com. So Judy, thanks so much for coming again. I so appreciate having this conversation with you. I think we're able to talk about how to treat aging skin and how to avoid overstuffed syndrome.
Thank you so much for having me. I really have enjoyed our time together and look forward to podcasts in the future. We have a very similar philosophy on how to treat patients to make them as healthy as possible.
Yeah, it's always so great talking with you. All right, till next time. Thanks so much. This has been Med Spa Mayhem with Dr. Kate D. We are so grateful you are listening, and we hope you have learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Medspa Mayhem comes out June 2024, available everywhere books are sold. You can pre-order now on Amazon and Barnes & Noble, and soon on bookshop.org. Links and more can be found on medspamayhem.com.